Interventions with a King. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
Hi, Dr. David Moliterno. I'm Chief of Cardiovascular Medicine at the University of Kentucky and also an Associate Editor for Jack Cardiovascular Interventions. I'm joined today by Roxana Marin, who is Professor of Medicine in the Cardiology Group at Mount Sinai Hospital in New York. She's also the Director of Cardiovascular Research there. And Roxana's going to talk to us today about a paper that's coming out in Jack Intervention soon, dealing specifically with chronic total occlusions, a tough topic, not easy to study, not too many randomized trials for sure, but you've got a very large cohort, followed for a long time. Kind of give us the bottom line.
So thank you for having me, and thank you for featuring this particular study that is a work of many, three centers in particular, coming together with over 1,700 patients who presented with a chronic total occlusion and in whom the chronic total occlusion was attempted. We have 2.9 years of follow-up in these patients. So a really great group of number of patients. What we found, very interestingly, what we reported was the success rate, which was 60% in the first attempt and overall 65%, which meant that you can bring patients back and reattempt. What we found that in those patients with a successful recanalization of CTO, that things went very well for them. They avoided bypass surgery. They avoided myocardial infarctions. Most of them, 3/4 of them, were treated with, or about 30% of them were treated with a drug-eluting stent, and the other with bare metal stent. So it gave us an opportunity to take a look at the outcome of BMS versus DES and see how that goes, which was really great.
So you're being a bit modest, I think. This is probably one of the largest studies, longest follow-up, and you had almost an 80% reduction in the need then for bypass surgery. So what I think happened, at least, is you took some patients who might otherwise have gone to bypass and really substantially lowered the likelihood of that happening beyond a mortality benefit, which is something we haven't seen heretofore. So what do you think about that?
Well, I think that it gives us first, I think it's important to recognize that these were high volume tertiary referral centers with great experience and amazing operators and access to all of these important new technologies and wires and things as such that have really improved and enhanced our ability to treat chronic total occlusions. That's I think an important element to talk about.
That's how you got to this nearly 70% success rate.
70% success rate, and I think that was quite good. And you were able to, these patients otherwise would have to go to bypass surgery. In fact, those patients who did not have a successful CTO did end up at some point going to bypass surgery.
And then the next major thing, I think, before I get your summary thoughts, is that in fact, those patients who got a drug-eluting stent, target lesion revascularization was lowered a fair amount, wasn't it?
It was significantly reduced by almost half, by about 50%. And importantly, because we had 3-year follow-up, we found that definite and probable stent thrombosis actually occurred at an equal
interesting
level.
So what's the take-home message for the viewers?
So the take-home message is that if you have access, if there is a chronic total occlusion with a high burden of ischemia, and I think it's really important that we actually have viability and ischemic and a good indication for opening the CTO. And in those cases, in a high-volume center with expert operators, you're able to, about 65 to 70% of the time, have a successful recanalization. And in those patients, you're able to avoid bypass surgery, reduce important clinical events, and that treating them with drug-eluting stents seems to be safe and efficacious.
Terrific. Thanks so much. Thanks to Roxana Marin. I'm David Moliterno, again joining you for Jack Cardiovascular Interventions.